The coalition started in 1996 with the leadership of Congressman Rob Portman.
A woman came to see me in Washington who was a constituent. She asked me what we were doing to help her and her community in terms of the fight against substance abuse. Her son, Jeff Gardner, lived in Claremont County, had just died. He died of an overdose of huffing gasoline and smoking marijuana with a bunch of his buddies. When she came to see me, she said, "What are you doing, Congressman?" And I said, "Well, you know, we spent $15 billion a year last year on the drug war, interdiction, and so on, and law enforcement." She said, "No, what are you doing to help me? What are you doing to help in our community?" That happened at the same time that, again, we were getting this information about increased drug use. I was getting some good information from the Partnership for Drug Free America and other groups that these community coalitions showed a lot of promise. So we gathered a group of Cincinnatians, leaders in the faith community, leaders in the business community, leaders who were already actively involved in the treatment of substance abuse in our area, and others, school officials and so on, and we decided we'd try this.
From humble beginnings, the coalition grew into one of the strongest coalitions in America, and the only coalition that has data showing its impact on the community.
We do have several communities in our region which have proven through our survey results a reduction in adolescent drug use. However, our goal is not only to work with adolescents, but it's to begin with children very young.
A community coalition is a group of individuals and organizations working collaboratively to build drug-free environments for youth. A coalition involves all sectors of the community, the media, the law enforcement, parents, youth, everybody who lives in the community, so that together we can take responsibility for building healthy environments for our young people.
By involving the whole community, we'll be able to have a greater impact in our communities. We'll be able to create the environment that we need in our community to eliminate drug usage.
This is an opportunity for us to say thank you. Thanks to everybody who's been involved, who has done this out of the goodness of their heart, because it's almost all volunteer effort. And to say we hope that now we can redouble our efforts, continue what we know works, which is prevention, education, treatment, and make a real commitment to continue this effort over the next 5 years so we can continue to have a safer, healthier community here in Greater Cincinnati, and so that we can continue to provide a national model and example so that the rest of the country can also begin to make progress in this area, and that we can, over time, truly make a difference in the lives of all our kids.